All right, ready to dive deep into sleep and all its weird quirks?
Oh, absolutely. Let's do it.
You brought a chapter from the Handbook of Clinical Psychopharmacology for Therapists. Heavy stuff.
It is,
So we're going way past the usual sleep hygiene stuff here, right?
we are, yeah. We're going to be looking at the connections between sleep and mental health, getting into those nitty-gritty details of how sleep disorders work, why they happen, what actually helps, you know?
Okay, love it. So we all know sleep is important,
Of course.
but I was blown away by this statistic at the beginning of the chapter. Over 50,000 car accidents a year are linked to drowsy driving.
Yeah.
I mean, talk about a wake-up call for how important sleep is for, well, everything.
It's true. It really highlights how vital sleep is for, like, our focus, our reaction time, our decision-making, all those things that keep us safe.
Absolutely. And the chapter really emphasizes that it's not just about, like, avoiding accidents. It's about, like, our brains need sleep to function properly.
Exactly.
It's like our brain's overnight reset button,
Yeah,
right?
it is, yeah.
It's when our memories get consolidated, emotions are processed, bodies repair themselves, skimp on sleep, and, well, those essential processes just don't work as well.
Yeah, they don't. And it can lead to all sorts of problems, trouble concentrating, feeling irritable, mood swings, even impacting our mental well-being in a more serious way.
So it's not just about feeling tired. It's like our brains and bodies literally aren't working at their best.
Right.
Okay, so this chapter gets into the actual mechanics of our sleep cycles.
Yeah.
I have to admit, I learned a lot here.
Oh, good.
I kind of always thought it was just like asleep or awake, but it turns out we're actually cycling through these different stages of REM and NREM sleep all night long.
We are, yeah, it's like a dance, really, between these different stages, and each stage plays a unique role.
So tell me about these stages. What's going on in each one?
So, like REM sleep, that's where most of our dreaming happens. It's where our brains are processing emotions, memories, experiences from the day.
So it's not just random nonsense happening in our dreams.
Not necessarily, no. It could be our brain working through things, even coming up with creative solutions.
Wow, okay. What about NREM sleep?
That's more about our body doing repairs, restoring energy, repairing muscles, boosting our immune system. It's like our body's overnight pit crew, getting us ready for the next day.
Oh, I like that analogy. Our body's pit crew. Okay, so it's not just about how much sleep we get. It's also about making sure we're cycling through these different stages properly.
Yeah, for sure.
Makes you think about those 8 hours a little differently, doesn't it?
It does.
Now let's talk about what happens when those cycles get messed up, those sleep disorders that steal our Z's.
Okay.
This chapter spends a good chunk of time on insomnia.
Yeah, it's a big one.
It seems like it's just like ridiculously common these days.
It is, and this chapter breaks it down in a way I hadn't seen before. It's not just trouble sleeping, it actually highlights these different patterns of insomnia.
Oh, interesting. Like what?
So, like initial insomnia, where you have trouble falling asleep in the first place. Then there's middle insomnia, where you're waking up a lot throughout the night. And then there's terminal insomnia, where you're waking up way too early and can't fall back asleep.
So like different flavors of insomnia?
Kind of, yeah. And what's interesting is that those patterns can actually give us clues as to what's driving the insomnia in the first place.
That's a really good point. So it's not just about treating the insomnia itself, but also trying to figure out, like, what's causing it in the first place, right?
Exactly.
So what are some of the potential culprits for insomnia?
Well, this chapter lists a ton of possibilities, everything from, the usual suspects like stress and anxiety, but also things like side effects from medications, even underlying medical conditions like chronic pain. It really emphasizes this like holistic approach to treatment. You can't just, throw a sleeping pill at the problem and expect that to fix everything.
No magic bullet.
Right.
So it's about playing detective a little bit.
A bit, yeah.
Figuring out what's really at the heart of the sleep issue. Now, I know a lot of people, when they have trouble sleeping, they turn to medication.
Yeah.
What does the chapter have to say about that? Is that a good approach, bad approach?
Well, it dives into the latest research on both medication and behavioral therapies for insomnia. It acknowledges that medication can be helpful in the short term, but it really stresses that for long-term relief, you have to address the underlying cause.
Okay, makes sense. So it talks about different types of medications.
It does, like hypnotics, benzodiazepines, but it also really dives into the potential drawbacks of those.
Drawbacks like what?
Well, things like, becoming dependent on the medication, developing a tolerance where you need more and more to get the same effect. Even some pretty serious side effects like sleepwalking, doing things while you're not fully awake.
Okay, yeah, that's not ideal.
Right, and that's why the chapter really emphasizes these behavioral therapies like cognitive behavioral therapy for insomnia, CBTI.
CBT.
Yeah, it's like retraining your brain to have a healthier relationship with sleep.
Interesting. So you're not just masking the problem, you're actually trying to fix it at the root.
Exactly. You're identifying those unhelpful thoughts and behaviors that are keeping you from sleeping and then learning new skills to like conquer those sleepless nights.
I like that. So it's about empowerment,
It is.
giving people the tools to take control of their own sleep instead of relying on medication.
Exactly.
Okay, we talked a lot about insomnia. What about nightmares? I feel like those are often brushed off as just bad dreams, but this chapter suggests they could be more serious than that.
Yeah, you're right. They often are just dismissed. The chapter points out that while most nightmares are harmless, if they're persistent, they can really impact your sleep quality, how you function during the day.
Interesting. So it's not just about the content of the nightmare, it's also about the frequency.
Yeah, the frequency and the impact it has on you. And it turns out they're more common than you might think, actually. A lot of adults report experiencing nightmares from time to time.
Okay, so what can you do about nightmares? Especially if you're having them regularly.
The chapter talks about this really interesting therapy called imagery rehearsal therapy, IRT.
IRT, okay.
It's basically like rewriting the script of your nightmare. You work on changing the story, turning it from something scary and unsettling into something less distressing, more positive. It's like taking control of your dreams, you
I
know?
love that. Turning the nightmare into something you can actually manage, like you're directing your own dream. Okay, let's move on to a sleep disorder that I've always found kind of mysterious. Sleep apnea.
Okay.
I know it involves breathing problems during sleep,
Okay.
but this chapter really helped me understand it better.
Oh, good.
So can you kind of break it down for me?
Hmm.
What's really going on with sleep apnea?
So sleep apnea is definitely a sneaky one. You can be spending hours in bed, but because your breathing keeps getting interrupted, you never get that truly deep restorative sleep.
It's almost like you're getting stuck in sleep traffic.
Yeah, you're never quite reaching your destination, even though you're putting in the time.
Exactly. So what are the telltale signs? Like, how do you know if you might have sleep apnea?
Well, the chapter explains that it's often characterized by these pauses in breathing while you sleep, sometimes even accompanied by loud snoring or gasping for air.
So snoring could be a red flag.
It can be, yeah, especially if it's really loud or if it's accompanied by those gasping sounds.
Okay, so if you suspect you might have sleep apnea, how do you actually get diagnosed?
It usually involves a special type of sleep study called a polysomnogram.
Polysom what?
Polysomnogram. It sounds intimidating, but it's actually pretty straightforward. You basically spend the night in a sleep lab.
A sleep lab, like a science experiment.
It kind of is. They hook you up to all sorts of monitors that track your brain waves, breathing patterns, heart rate, all that good stuff. And this helps doctors identify those breathing interruptions that are, the signature of sleep apnea.
So pretty high-tech stuff.
Oh, yeah. It's pretty amazing what they can do these days.
And what about treatment? What's the go-to solution for sleep apnea?
The most common treatment is something called continuous positive airway pressure therapy, CPAP therapy for short.
I've heard of CPAP machines. Those are the ones where you wear a mask, right?
Exactly. It involves wearing a mask over your nose or mouth while you sleep, and that mask is connected to a machine that basically blows air into your airway, just gently, to keep it open and prevent those breathing interruptions.
I've heard some people say those masks are uncomfortable, though. Is that a common complaint?
It can be an adjustment at first, for sure.
Yeah?
But the benefits of a good night's sleep and improved health usually outweigh any initial discomfort. Plus, the technology for these masks is constantly improving.
That's good to hear.
Yeah, they're becoming more comfortable, more user-friendly all the time.
And I know that in some cases, surgery can be an option too, right? To address structural issues that might be contributing to the sleep apnea.
Yeah, that's right. But the main takeaway here is that early diagnosis and treatment are crucial. You want to catch it early and get it treated to prevent those long-term health complications that can come with untreated sleep apnea.
Like what? What are some of the risks of letting sleep apnea go untreated?
Well, things like heart problems, cognitive decline, even an increased risk of stroke.
Okay, so definitely not something to mess around with.
Nope.
Okay, let's shift gears to another sleep disorder that can really steal those precious Z's. Restless leg syndrome.
Ah, restless leg syndrome.
I always kind of thought that was just like a fidgety thing, but the chapter really drives on the point that it's a legitimate neurological disorder.
It is, yeah. It's more than just feeling fidgety. It's this overwhelming urge to move your legs, especially when you're trying to relax or sleep.
So it's not just like, oh, I need to stretch my legs. It's like a real discomfort.
It is, and the more you try to resist the urge to move, the worse it gets. It can be very frustrating.
Oh, I can imagine. The chapter mentions that, moving your legs does provide temporary relief, but then the urge to move comes right back as soon as you try to settle down again.
It does, yeah. It's like you can never quite get comfortable.
So frustrating. So what causes this strange urge to move? Does the chapter offer any explanations?
Well, it explores a few possibilities like genetics, iron deficiency, even certain medical conditions, but it seems like the exact cause is still a bit of a mystery.
Ah, the mysteries of the brain.
Right.
So if we don't fully understand the cause, that makes treatment a little more tricky, doesn't it?
It does, yeah. But the chapter outlines some approaches that can be helpful.
Like what?
So for some people, simple lifestyle changes can make a big difference. Things like regular exercise, avoiding caffeine and alcohol, sticking to a consistent sleep schedule.
Okay, so those kind of like foundational sleep hygiene things we talked about earlier.
Yeah, it's about creating those healthy habits that support good sleep overall.
And if those lifestyle changes aren't enough,
Then, for more severe cases, medication might be necessary.
what kind of medication are we talking about here?
Well, the chapter delves into a few different types that can be helpful, like dopamine agonists, which are also used to treat Parkinson's disease.
Oh, wow, interesting. I didn't realize those were used for restless leg syndrome, too.
Yeah, it's interesting all these medications can sometimes have overlapping applications.
It really is. Makes you realize how much we still have to learn about the brain and how it works.
Absolutely.
Okay, so dopamine agonists are one option, but are there other types of medications used for restless leg syndrome?
Yeah, the chapter also mentions things like benzodiazepines, those are sometimes used, and certain anticonvulsant medications as well. But it really emphasizes that the effectiveness of medication can vary a lot from person to person.
Makes sense. Our bodies are all different.
They are, so finding the right medication and the right dosage often involves some trial and error.
And that's where working closely with a healthcare professional is key, right?
Oh, absolutely. You want someone who can help you navigate those options and figure out what works best for you. You know, one thing that really struck me in this chapter is how often sleep problems are kind of overlooked when you're treating mental health conditions.
Yeah,
It's like this hidden piece of the puzzle that can really make it harder to get better.
totally. Like if you're already dealing with anxiety or depression, and then you add sleep deprivation on top of it,
Right.
it's like, forget it. You're trying to climb a mountain with a backpack full of rocks.
Exactly. It's this vicious cycle, right?
Yeah.
The sleep problems make the mental health symptoms love, and those symptoms make it even harder to sleep.
Yep.
And the chapter really drives home the point that therapists need to address sleep issues head on, not just as like an afterthought.
Okay, so let's dig deeper into this whole connection between sleep and mental health.
All right.
The chapter mentions that pretty much all psychiatric conditions can involve sleep disturbances.
Yeah.
Anxiety, PTSD, depression, bipolar disorder, like you name it. It can mess with your sleep.
Pretty much, yeah. It's like sleep becomes this window into our emotional state, you know?
Oh, interesting.
If we're stressed or anxious or feeling down, it often shows up in how we sleep.
So our sleep is like trying to tell us something. Like, hey, something's not right here.
Kind of, yeah.
Okay, so how do we break free from this cycle of sleep problems and mental health challenges? What does the chapter suggest?
Well, it advocates for this kind of multi-pronged approach because there's not really a one-size-fits-all solution.
Okay,
Sometimes treating the mental health condition directly can lead to improvements in sleep.
makes sense.
So, for example, if someone's insomnia is rooted in anxiety therapy and learning anxiety management techniques,
Okay.
that might be the key to unlocking better sleep.
So sometimes fix of the underlying problem can also fix the sleep problem.
Yeah, sometimes. But what if the sleep problems kind of stick around even after mental health symptoms improve?
Right, that's got to be frustrating. Like, I'm feeling better emotionally, but I'm still exhausted.
It can be, yeah. That's when it becomes crucial to look at those specific interventions that target the sleep issues directly.
Like what? What are we talking about?
Well, that CBTI, that cognitive behavioral therapy for insomnia we talked about earlier, that's a really good example.
Oh, right, CBTI. Remind me again how that works?
So it's all about identifying and changing those negative thoughts and behaviors that are contributing to poor sleep. You're basically rewiring your brain to have a healthier relationship with sleep.
Right, so you're not just putting a Band-Aid on the problem.
Exactly.
And then, of course, there's always medication.
Yeah,
But sleeping pills, they can be a bit of a double-edged sword.
they can.
What does the chapter have to say about that?
Well, it provides a very balanced view of sleep medications. It acknowledges that they can be helpful, especially in the short term, but it really highlights those potential downsides of long-term use.
Like what?
Well, there's the risk of dependence, where your body starts to rely on the medication to fall asleep.
Okay.
And you have tolerance, where you need higher and higher doses to get the same effect. And the chapter also mentions some less common but pretty worrisome side effects. You know, sleepwalking, sleep eating, even driving while not fully awake.
Yeah, I've heard some stories. Not good.
Right. it can be scary stuff.
Yeah, for sure. So it sounds like sleep medication, it's a use with caution situation.
Definitely. It's really important to have an open and honest conversation with your doctor about the risks and benefits, especially if you're thinking about long-term use.
Makes sense. So medication might be part of the solution, but it's not the whole story. Now, earlier we talked about insomnia and nightmares.
Mm-hmm.
This chapter covers a whole bunch of other sleep disorders, too.
It does, yeah.
So what else is on that list?
Well, we have sleep apnea, which we touched on earlier.
Right, right. The stuck-in sleep traffic one.
Exactly. And it can lead to excessive daytime sleepiness and even some pretty serious long-term health consequences if it's not treated.
Okay, so how is sleep apnea diagnosed? I know we touched on this a little bit before, but maybe we can go into a little more detail.
Sure. So it often involves that sleep study, the polysomnogram.
Yeah, the sleep lab one.
Right, where you spend the night in a lab hooked up to all sorts of monitors.
Right.
They track brain waves, breathing patterns, heart rate, oxygen levels, all that good stuff. And this helps doctors really pinpoint those breathing interruptions that are kind of the hallmark of sleep apnea.
So it's all about, like, getting those objective measurements,
Yeah,
right?
exactly.
All right, so what about treatment? What's the go-to for sleep apnea?
So the most common treatment is that continuous positive airway pressure, the CPAP therapy.
Right, the mask.
Yeah, where you wear a mask over your nose or mouth while you sleep, and it's connected to a machine that gently blows air into your airway, keeping it open, preventing those breathing interruptions.
And are those masks really as uncomfortable as people see they are?
It can be an adjustment for sure,
Yeah,
but the benefits of actually getting a good night's sleep and improving your health, those usually outweigh the initial discomfort.
that makes sense.
And, the technology for those masks is always improving.
Okay, good.
They're getting more and more comfortable, user-friendly.
Great. And in some cases, surgery is an option too, right? To address any structural issues that might be contributing to the apnea?
Yeah, that's right. But the main takeaway here is early diagnosis and treatment are super important.
Makes sense.
You want to prevent those long-term health problems that can come with untreated sleep apnea.
Right. So like heart problems, things like that.
Yeah, exactly. Heart problems, cognitive decline, increased risk of stroke, things you really want to avoid.
Right. Sleep apnea, not something to mess around with.
Nope.
Okay, let's talk about restless leg syndrome. I know we touched on this earlier.
Okay.
And I feel like a lot of people don't realize it's actually a real neurological disorder, not just like fidgeting.
It is.
So for people who haven't heard of this before, can you explain what exactly restless leg syndrome is?
Sure. So it's this overwhelming urge to move your legs, especially when you're trying to relax or sleep.
And it's not just a mild urge, right? It's like almost painful.
It can be, yeah. And the more you try to resist it, the worse it gets.
The chapter mentions that moving your legs provides temporary relief,
Yeah.
but then the urge to move comes right back as soon as you try to settle down again. It's like so frustrating.
It can be, yeah. It's this constant cycle.
So what causes this urge to move? Like, why do people get this?
Well, the chapter explores a few potential causes, things like genetics, iron deficiency, certain medical conditions, but the exact cause is still a little bit of a mystery.
The brain, always keeping us guessing. So if we don't fully understand the cause, that makes treatment a bit tricky, doesn't it?
It does, yeah, but there are some approaches that can be helpful.
Okay, like what?
For some people, just simple lifestyle changes can make a difference.
Like what kinds of things?
Regular exercise, avoiding caffeine, alcohol, sticking to a consistent sleep schedule, kind of creating those healthy habits that support good sleep overall.
Right, those foundational things we talked about earlier.
Exactly, but for more severe cases, medication might be necessary.
Okay, so what do we talk about here? What kind of medications?
Well, the chapter mentions dopamine agonists. Those are often used.
Right, those are the ones that are also used to treat Parkinson's disease.
Yeah, exactly. It's interesting how those can be used for different conditions.
It really is. It's like these medications have a multi-purpose toolkit.
They do, yeah. And then there are other medications as well, like benzodiazepines. We talked about those earlier.
Right, for insomnia.
And certain anticonvulsant medications can be helpful too, but the chapter really emphasizes that the effectiveness of medication can vary a lot from person to person.
Okay, that makes sense.
So finding the right medication and dosage often involves some trial and error, working closely with a healthcare provider to see what works best for you.
So personalized medicine, basically.
Exactly. And it's super important to be aware of any potential side effects. Talk to your doctor if you experience anything unusual.
So we've covered a lot of ground here in this deep dive. We've talked about the importance of sleep, the science behind how it works, the many challenges that can arise when our sleep is disrupted.
Yeah, we have.
And we've explored a whole range of disorders from insomnia to restless leg syndrome, talked about treatment options, both medication and non-medication approaches. Hopefully our listeners are feeling more informed and empowered to take control of their sleep.
Yeah, that's the goal.
Now, we focused a lot on those non-medication approaches.
Hmm.
But as we've mentioned, medication can play a role too.
Oh, for sure.
And that's actually what we're going to be diving into in the next part of our deep dive, the pharmacological side of managing sleep disorders. We'll be talking about the different types of medications used, the potential benefits and drawbacks, all that good stuff.
Looking forward to it.
Okay, let's talk sleep meds. It feels like everyone has an opinion about sleeping pills, you know?
I know, right? Lots of strong opinions out there.
Yeah.
It's like people either swear by them or totally avoid them.
Exactly. So how do we make sense of all of this? What's the balanced perspective on sleep medications?
Well, I think the key is to see them as tools, right? They can be really helpful, especially in the short term.
Okay.
But like any tool, you got to know how to use it safely and be aware of the potential risks, especially if you're thinking long term.
Right, right. So let's start with insomnia, since it's the most common sleep disorder out there.
Okay.
This chapter lists a whole bunch of different types of medications used for insomnia.
Hmm.
Hypnotics, benzodiazepines, even some meds that aren't originally designed for sleep but have those sedating effects. It's a pretty diverse toolbox.
It is, yeah. It's interesting how many different options there are.
So let's break it down. Let's start with hypnotics. Those seem to be pretty popular.
They are, yeah. You've probably heard of some of the brand name, like Ambien, Lunesta, Sonata.
Oh, yeah. I've definitely heard of those.
Those are all hypnotics. And they basically work by increasing the activity of this neurotransmitter in our brains called GABA.
GABA.
And GABA is what helps us relax and fall asleep. So these medications, they can be really effective. They help people fall asleep faster, stay asleep longer.
Sounds great, but I'm guessing there's a but coming.
Well, there are some potential downsides. The chapter really cautions about the risk of dependence with long-term use.
Dependence, meaning what? Like you become addicted to them.
Kind of, yeah. It's like your brain starts to rely on that medication to fall asleep, and then it gets harder and harder to do it naturally on your own.
Oh, so it's like a crutch that you become reliant on.
Yeah, that's a good way to put it.
Okay, so that's dependence. What else? What are the other potential downsides?
Well, there's also the issue of tolerance,
Tolerance.
meaning you might need higher and higher doses of the medication over time to get that same sleep-inducing effect.
Ah, so your body kind of gets used to it.
Exactly. And then, of course, there are also the side effects.
Right. I was going to say, there's always side effects. What are we talking about here?
Well, some of the more common ones are things like dizziness, headache, daytime drowsiness.
Okay, that makes sense. But are there like more serious ones too?
Yeah, there can be. The chapter mentions some less common but pretty concerning side effects like sleepwalking, sleep eating, even driving while you're not fully awake.
Oh yeah, I've heard some stories about those. Not good.
Not good at all. So it's definitely something to be aware of.
For sure. So it sounds like hypnotics, they can be helpful, but you really got to use them with caution.
Absolutely. It's really important to talk to the doctor about the risks and benefits.
Okay, what about benzodiazepines? I know those are often used for anxiety.
Right.
But the chapter mentions they're sometimes prescribed for insomnia too.
Yeah, they can be.
Why is that? How do they work for sleep?
So benzodiazepines, those are medications like Xanax, Ativan, Valium.
Okay.
And they also work by increasing GABA activity in the brain, just like the hypnotics.
Ah, so they kind of have that same calming effect.
They do, yeah. So they can definitely be effective for short-term relief from insomnia.
Short term, okay.
But just like hypnotics, they come with that risk of dependence and tolerance.
Okay, so not really a long-term solution. Got it.
Right.
What about those meds that have sedating effects but weren't really designed as sleep aids? I think the chapter mentioned a couple of those.
It did, yeah.
Like trazodone, I think was one of them.
Trazodone, yeah. That one's interesting.
What's the story with that one?
So trazodone is actually an antidepressant,
Okay.
but it's often prescribed at lower doses specifically for its sleep-promoting effects.
So it's like repurposing an existing medication.
Exactly. It's like a side hustle for trazodone. And it works a bit differently than the hypnotics and benzodiazepines.
How so?
Well, it influences serotonin levels in the brain instead of just GABA.
Oh, interesting. So it might be a good option for someone who's not finding relief with those other medications.
Yeah, it could be. Or for someone who's also dealing with depression, it's like hitting two birds with one stone.
Right, right. Okay, and I think there was another one, doxepin, maybe?
Abipin, yes.
What about that one?
So that one's an older tricyclic antidepressant, and it's actually FDA approved now specifically for insomnia.
Oh, wow. So it's kind of gone legit as a sleep aid.
It has, yeah. It's sold under the brand name Silenor, and they typically prescribe it at a very low dose just for sleep.
Okay, so it's specifically targeted for sleep, which makes sense.
It does. It's amazing how these medications can have these, like, multiple uses depending on the dosage and what you're trying to treat.
It really highlights the complexity of, like, the whole world of pharmacology, doesn't it?
It does. It's fascinating.
Okay, so we've talked a lot about insomnia meds, but what about meds for other sleep disorders, like sleep apnea, Restless legs.
Right.
What's the deal with those?
So for sleep apnea, the primary treatment is usually that CPAP therapy we talked about.
Right, the mask.
But sometimes medications are used to address the daytime sleepiness that often comes along with sleep apnea.
Oh, that makes sense. Like if you're not sleeping well at night, you're going to be dragging during the day.
Exactly. So the chapter mentions stimulants like Adderall and Ritalin.
Oh, wow. Stimulants.
Yeah, they can help improve alertness, reduce fatigue.
Okay, but those also come with some risks, right? I know stimulants can be addictive.
They can, yeah. So it's really important to use them cautiously and only under the supervision of a doctor.
Makes sense. Any other options for daytime sleepiness with sleep apnea?
The chapter also talks about these newer medications called wake-promoting agents. Those are medications like Provigil and Nuvigil. They work a little differently than traditional stimulants, and they have a lower risk of abuse.
So it seems like there's this constant push to develop safer, more effective meds for sleep disorders.
There is, yeah. Science is always advancing. Hopefully, we'll have even better options in the future.
Fingers crossed. Now, what about restless leg syndrome? What does the chapter say about medications for that?
So it mentions those dopamine agonists again, the ones we talked about for Parkinson's.
Right, right. So again, those multi-purpose meds.
Exactly. It's fascinating how they can be used for these seemingly unrelated conditions.
It really is. It really speaks to how much we still have to learn about the brain.
It does, yeah.
Are there other types of medications used for restless leg syndrome besides those dopamine agonists?
Yeah, the chapter also mentions benzodiazepines sometimes. Those can be used, and some anticonvulsant medications can be helpful too. But it's important to remember that the effectiveness of medications can vary a lot from person to person.
Of course, everyone's different.
Exactly. So finding the right med and the right dosage often involves some trial and error working with your healthcare provider.
Right, to figure out that personalized approach.
Yeah, exactly.
Well, this deep dive into sleep meds has really highlighted how important it is to be informed, to be cautious.
Absolutely.
These meds can be valuable tools, but they're definitely not without risk.
It's all about balance, right? Using medications when appropriate, but also exploring those other treatment options.
Right. CBTI, lifestyle changes, addressing any underlying medical conditions. It's about not just masking the problem, but actually trying to get to the root of it.
Exactly. And it's about empowering ourselves to make informed decisions about our health, which is what this whole podcast is all about.
That's right. Knowledge is power, especially when it comes to something as essential as sleep. Well, I think we've covered a ton of ground in this deep dive into the world of sleep and its disorders.
Yeah, we have.
We explored the importance of sleep, the science behind it, all the challenges that can arise when our sleep goes off track, talked about insomnia, nightmares, sleep apnea, restless legs. We even took a deep dive into the world of sleep medications. Hopefully you, our listener, are feeling a little bit more informed and empowered to take control of your own sleep and seek help if you need it.
Yeah, absolutely.
So remember, prioritize your sleep. It's one of the best things you can do for your overall health and well-being.
Couldn't agree more.
Sweet dreams, everyone.
Sleep well.